$1,352,103.32.
Okay.
Okay, now Stokes is here.
Okay. We're delayed. Okay, we good, Mark?
Yeah.
Okay, first up, we're gonna have Matt Rusa and Tisha Cook come up and give their report on, come on, Tisha, you're a part of this too. Okay. Come on right up here, Matt. Okay. Mark, you gotta have a mic for Matt. Mark, mic for Matt.
Thank you very much. You can hear me great. And I'll just let you advance, whoever's advancing. If that's.
Hold on one second. I gotta get this on for the people on Zoom. There's a lot of stuff to organize.
No, thank you. Appreciate that, Mark. While we're getting it up and running, my name is Matt Rosa. My background is in clinical social work as a director of agencies, substance use, mental health agencies, worked as a as a county planner for a good number of years. I now work full-time as a consultant in the areas of implementation of best practices, quality improvement, and I'm happy to be working with Madison County on the work that they've been, the leadership has been engaged with. Chairman Becker, Mark Simone, and a number of other folks, some of the department heads who are here, and other folks, Cliff Moses as well, and some others who put together a mental health task force because of a really strong orientation to the aftermath and continuing challenges of COVID and other stressors and the challenges of the community, of individuals, of families. And so there was a really strong orientation from leadership that there was a need to take a look at the community's needs related to the stressors that people have been experiencing. So with that group, we put together a thoughtful committee. We've done, and I'll show you a few slides here in just a minute of some of the work that we've done in terms of being able to do some research and outreach to the community. First, we started with some stakeholder interviews where we talked to some of the key stakeholders in the community about their perceptions related to the stressors that people have been experiencing. And we did some really sort of thorough surveying of a bunch of different stakeholder groups. We surveyed seniors, we surveyed adults, we surveyed folks who were receiving mental health care through the county clinic. We surveyed schools, churches. We did some kind of creative strategies for outreaching to seniors by connecting it to home delivered meals, for example, to try to get their feedback in terms of their stressors. So this is a first slide here to give you a little sense of the sequence of our work. As I said, we had leadership identifying needs, then we developed this mental health task force among those leadership representatives. We did a number of surveys throughout the community, and then we did some data analysis of those surveys. And as a result, we came up with some strategic plans, and I want to share with you where we're at right now in terms of our next steps in action. I'm always a fan of really thoughtful planning on the front end, rather than just sort of taking action with good intentions. We really want to be data-driven and do some analysis of what's happening in the community to really be able to be effective with the work that we do. So we can go to the next slide. Oh, thank you. This is the logo that we came up with. Thanks to Sam who helped us in developing this. What we're trying to do here is to focus on mental health and wellness, not from a clinical perspective, not from a sort of disorder or disease perspective, but from a kind of global wellness perspective. Everybody needs to be considering wellness. Everybody needs to manage stress. Everybody needs to work on what their personal goals are. Everybody needs to be connected to their community in ways that help them to thrive and be successful. So you can go ahead and dial up all these, Tisha, for me. These are the priority populations that we generated. Probably not too surprising to most of you to look at that list. These are different groups of folks where we view a need for some targeted focus in terms of dealing with stressors related to COVID, related to some of the economic issues, related to some of the conflicts in our culture that people have been experiencing, sort of this us-them sort of factions that have created stressors. A lot of concerns related to schools and children in schools, which was one of kind of the driving forces of the effort. And what's this been like for kids when they weren't able to be in schools, et cetera. So we did some surveys, and this is just an example of a survey that we created. We did some sort of progressive efforts to try to use QR codes so that people could use their phones to take the survey. On the right, you see some of those, an example of the survey, and you can see the kinds of questions that we ask. We don't ask if people are experiencing mental health conditions. We ask less stigmatizing questions. Are people reaching their goals? Are they experiencing stress? How are they feeling about their level of stress now compared to before COVID started? And so, as I said, we surveyed these various groups. And so big picture here are a few highlights of what we learned. And you can just go ahead and populate that one. Thanks, Tisha. No surprise, COVID's very stressful. There is some us-them stuff out there. You know, sometimes certain regions or certain communities within the county might feel like they're not having as many opportunities, or maybe their issues or needs are not being addressed, and that can contribute to stress. People had a strong desire for mental health supports and wellness supports in natural settings. And by natural settings, we mean places like schools or community centers, or places that would not be a traditional kind of a medical or healthcare environment like a clinic setting. So, people need social and family connections, of course. These are all things that we're all aware of. Wellness and physical health, people kind of connect those to each other quite a bit. There's a lot of concerns around social determinants of health, issues around people's access to resources, socioeconomic kinds of concerns, folks living in poverty, and how that has an impact on health. Clinic services, people who receive clinic services tend to be able to manage a lot of their stresses pretty effectively. It shows the benefit of the clinic services that are available. And a really strong indicator from teachers throughout the county about their concerns about students. Had a high level of concern, higher than their families did, in terms of their perception of the students' stressors as they've gone through all the transitions that have occurred over the last couple of years. And that seniors who we spoke to were doing pretty good, but of course we have to think about that subpopulation who are responding. Those seniors who might not have been doing so good, we might not have been hearing from. So we need to keep an eye on that. So we did some good planning based upon these issues of concern. So you see some of the factors that we started to analyze and review. And so I'm not going to go through this table, but I just wanted to give you a table with a bunch of ideas on it, sort of to represent the kind of analysis that we started to do, really kind of looking at all the factors and variables of concern and kind of trying to boil those down based upon the feedback that we received across a number of different surveys, meetings, interviews, et cetera. And then we had a subgroup that worked to take that information to define some clear strategies. And here are 7 strategies that have emerged for us through our process. So we see school-based mental health wellness services and supports. So we're actively working now to develop a school-based approach to enhance mental health and wellness services for kids in schools. Working on primary care wellness promotion, accessing the existing infrastructure of primary care health providers who are in many ways the #1 provider of mental health services. If the #1 provider of antidepressant medications and anti-anxiety medications are not psychiatrists, it's primary care physicians. So they do a lot of this work. So we want to work effectively with them. And then in terms of infrastructure, you see the last 5 items there. Working with the mobile crisis services that already exist in the county and enhancing them and growing them. Working with the mobile integrated healthcare that is in development to try to make sure that there is this holistic approach so that when we're doing outreach and engagement with emergency medical services, that mental health services are also included in that process. Working on community development, working for hubs, working on building relationships throughout the county and in all regions of the county to make sure that we have good access, both in the south as well as in the north. So in the population centers, we might have easier access to some services and supports, whereas in the southern part of the county, maybe not as much. So how do we make sure that the access is balanced throughout the county? And then longer term, there are a couple of longer term projects that will be emerging across time. The Wi-Fi work, broadband work, trying to enhance that access, as well as some housing projects that are in the works, because we know that healthy and safe housing is critical to people's wellness. So these are the current work groups that we have active right now. one for school-based mental health, one for primary care, one for crisis services, and one for those wellness resources in that community development approach. So we have subgroups building off of our task force with the addition of some additional staff members who are working actively with us to implement those four approaches throughout the county. And so this is our guiding model right now in terms of our areas of focus for working on well-being, mental health well-being throughout the community across those 6 areas. And so that is an overview, and I'll certainly take any questions if anybody has any.
What kind of response did you get from the survey? Did you get 1,000 or what was the numbers for that?
We were in the hundreds. Some of the surveys it's hard to get volume on these kinds of surveys. We don't expect them to be huge. In large part, anything that has to do with wellness or behavioral health kinds of stuff, it tends to still be stigmatized, unfortunately. Plenty of people will tell you whether or not they had their appendix out, but they don't want to tell you whether or not they take Prozac.
Was the sampling large enough for you to make some good determinations? I
From
guess?
a quality improvement perspective, I would say yes. From a research perspective, I would say no, but we're not doing research. We're doing quality improvement inquiry, and that I think was absolutely adequate. And I appreciate that question.
Yeah, how are you involving the primary care providers in this working group?
Well, we're just starting that process. We've developed an initial orientation. One of the first things we want to do is to create some really simple access resources for them, like simple one-pagers, because they often struggle with accessing behavioral health services. Their staff doesn't have the time. They themselves don't have the time. So clear, easy information for them to use, for them to distribute to patients. And then we're going to go out and do some detailing modeling, similar to what might happen with other kinds of education with primary care providers, where we send folks out into the community to talk to the primary care provider and to make sure that they're up to speed on what is available in the community and that they have the resources they need. So we're going to be doing that over the next couple of months, where we'll start reaching out to the primary care providers.
Okay. So I guess that wasn't quite my question. My question was, are there primary care providers through Madison County's Health Board that are working on that group? That was my question. Like, do you have them involved in the development of the program?
They are not involved yet, but we're at a very it would be premature to have them at the table yet. I think once we get an initial drafted product and some materials for them to then review and for us to then reach out to them and speak with them, I think that's when we'll engage them and they'll be able to work with us.
Matt,
Yeah.
can I just interject?
Yeah, thanks, Tisha.
We have on some of the community development work groups, we haven't started those yet, but we have some hospital personnel from both the hospitals invited to join those work groups. And then what Matt was referring to was the public health detailing activities that the public health department has done related to like opiate prescriptions and other things. We're using that model. And so the public health department is on the work group with us developing those resources, since they have the knowledge and the history on how to do that.
Yeah.
I'm just wondering what kind of strategy you have to reach out to the southern end of the county, to the individuals down in the rural areas.
Yeah, I think one of the key issues is we talked about natural settings, natural environments. For example, schools. I think that's going to be one of the places. We actually, Tisha and I were just talking about the list in terms of our outreach to the schools, that we have some schools within the southern part of the county who have indicated their interest in piloting some efforts, expanding their access to wellness or mental health services. So school-based will be one effective strategy. Thinking about telehealth as it relates to accessing services as well. And I think that ties into the broadband longer term in terms of creating access points. And then looking at community development and considering hubs within certain towns or communities where we can partner with a local environment, a local stakeholder, where we have a space that can create some safe private opportunity for folks to access services. So that will be a work that we'll be doing over the next year, is trying to identify some of those locations. And I think that they're out there. It's just a matter of really finding them. There are always spaces that will suit these needs. We don't require a lot of high tech or complexity in these environments. We just require some safe, easy access and private environments, particularly rural environments where people might have concerns about their privacy. How do we maintain that? So, sure.
Also, the community development model has kind of evolved in the last few months. And so we're looking at projects that would reach all areas of the county that would have a large impact. So some, educational and training opportunities that people can participate in. And then also, we have been in conversation with some folks that work with the elderly population in the southern part of the county. And so we're trying to kind of build that relationship and define things going forward.
And we have had a really, I think, keen awareness of some of the experiences of folks in communities that have had less access to resources and really needing to be mindful of an inclusive process. So I think so far we've been guided by that notion pretty effectively. Any other questions?
Yeah, one quick one, Matt.
Yes.
Regarding primary care physicians, the hospitals, have you thought about the urgent care also, like now? People are using that so much more now. I've found that even some primary care physicians, if you're sick, they say, don't come to the office, go to now. So, right? Yeah. So that might be, it's a growing part of the
Agreed.
medical.
We get calls from them, our department, on people in crisis, and we never had before. And so I think they're definitely in our plan. Yeah.
Unless there are any other questions, just one comment I just want to make in closing. I work in a lot of different communities doing this kind of work, and I usually don't see the level of commitment and focus around wellness, around mental health from leadership that I've experienced here. So I think it's worth noting that leadership right out of the gate didn't need to be convinced that this was important, but was coming to resources and saying, this is important and we need to take steps and we need to be mindful of our folks' needs and their management of stress, given many of the things that have been happening. So I'm appreciative of that and happy to be working and partnering with the leadership here in Madison County. So thank you all.
We will also have a website that's going up today after the meeting, and we will continue to put information as it unfolds on there so people can go and look at that. It's a public website for everyone. So thank you for having us today.
Thank you. Appreciate it. Thank you, Tisha.
We'll share that website with the board.
After we get done dealing with the assembly districts, we'll probably need your services. Okay, 11:15, we have a public hearing to review the request for additions to agricultural districts. We're a little bit late on that. That's okay. So I need a motion to open the public hearing on the ag district. Motion by Mr. Moses, seconded by Mr. Roberts. Is there any discussion? All in favor signify by voting aye.
Aye.
Anybody opposed? Carried. Okay, review the request for additions to the ag districts 1C, 3C, 4C. Scott, you want to just give us a quick rundown so people aren't in the dark here? Thank you.
All right, this is just, we do this once a year. In October for Madison County is open enrollment month. It gives those that want to put property into an agricultural district the time to do so. We make it available and known through multiple channels, and folks are given an application which they submit to the county. We process them and review them with the county's Agriculture and Farmland Protection Board, and then bring them here to the Board of Supervisors before they go on to Ag and Markets. And so I would say it's a positive sign when we have people applying to have property put into a district. This year we had a number of properties, and all were approved for inclusion in the district. And that's what this process is here for, just part of our annual cycle that we do.
Thank you, Scott. Anybody have any questions? Okay, motion to close the public hearing, please. Motion by Mr. Jones, seconded by Mr. Bernard. Is there any discussion? All in favor signify by voting aye.
Aye.
Any opposed? Carried. Okay, next we have a public hearing for renewal of Ag District 4C for the towns of Georgetown, Lebanon, Hamilton, and Brookfield. I need a motion. Motion by Ms. Schwartz to open the public hearing, seconded by Mr. Reuter. Is there any discussion? All in favor signify by voting aye.
Aye.
Opposed? Carried. Okay, the public hearing is open for these for 4C Ag districts. Is there anybody here to speak for or against them? Okay, seeing none, motion to close the public hearing. Motion by Mr. Moses, seconded by Mr. Bernard. Is there any discussion? All in favor signify by voting aye. Anybody opposed? Carried. Okay, we're on to resolution.
Okay. Resolution of appreciation, resolution number 1, employee recognition. Mary Kavanaugh, Chairwoman, Government Operations Committee.
Mr. Chairman, I move this resolution for adoption.
Resolution's been made. Do I have a second? Second by Mr. Roberts. Is there any discussion? All in favor signify by voting aye.
Aye.
Any opposed? Carried. Okay, first we have Sheriff's Office with Jane Black with 27 years of service.
As the chairman said, Jane's been with the county for 27 years. She started in the county clerk's office, I believe, and came to the sheriff's office in 2008. She's worked in the civil division and the records office, and she has done very well in both of those places. We're going to miss her. She takes care of all of our records and make sure stuff gets to the courts and does a very good job at it. I think Jane plans to spend a little more time with her granddaughter. So she's leaving us to go play with her granddaughter. You know, I can't blame her, but congratulations and you will be missed.
Sheriff, she'll stay up here. Next, we have Rocco DePerno with 7 years of service with the Sheriff's Office.
Rocco came to us after working several years in North Syracuse. Not sure why we took him, but Rocco started with the sheriff's office as a patrol deputy. He's gone into investigations, narcotics. Rocco can talk anybody into anything. He's done very well with our narcotics, has made a ton of narcotics arrests for us. We are going to miss him. However, he's decided he's had enough of New York State and is moving to Florida. So, congratulations, and you'll be missed.
Thank you very much. I appreciate everything the county's done for me.
Next, we have a staple of being seen around the buildings here for many, many years. Does a great job. John Henderson from Building Maintenance, 27 years of service. Got the right hand on you. Congratulations.
Thank you very much, gentlemen. Oh, hi.
Good, how are you? John's 27 years of 9 months of dedication. I can only emphasize the dedication. John is always consistent, always has done just a great job. I can always guarantee that I would have a great conversation with John. He'd bring me laughter, smile, getting smiles now, so, but he's done a great, outstanding job. He's been fantastic. And again, I applaud the dedication that you've done for the county for all these years. Best of luck.
Okay, next we have Social Services, Doreen Duncan with 10 years of service. today?
Me today.
That's all right.
So I'll just be brief. Doreen wasn't able to join us. She's been with the department for 10 years, answering our phones, greeting people at the door, and has always been very compassionate for folks who need our services in the county. We're going to miss her services. So make sure she gets in. Yeah, thank you.
Next, we have out of our county clerk's office with 5 years of service, Gail Drury. Where's, county clerk? You kidding me? He's missing a chance to speak. Huh? Yeah, you should.
Because he's not doing this.
Yeah, he'll be mad. You want to speak?
No.
He comes up all hopped up to tax everybody and then takes off. That's all he wanted to do.
Courthouse, I think we give him 5 minutes. We could just bring her back.
Sorry, we'll bring you up in 5 minutes.
He said, oh crap.
Well, what's here?
The courthouse. I don't know.
Jeez.
Oh, boy.
That's a first.
That is a first. Okay, go ahead.
Okay, resolutions preferred agenda. We'll start with Government Operations Committee. Resolution 2, designating the EMS Division of Emergency Management, a healthcare component of HIPAA, and approving the execution of business associate agreements required with certain county departments. Number 3, amending the wage rates and fringe benefits for non-represented employees and Teamsters bargaining unit job titles, policy and procedures. Number 4, abolishing a Director of Administrative Services position and creating a Deputy Director of Administrative Services position in Public Health. Number 5, authorizing a settlement agreement relative to opioid crisis. Number 6, authorizing the modification of an agreement with Ready Shred Acquisition. Number 7, authorizing agreement with Madison County municipalities for IT services. Number 8, authorizing renewal agreement with One Group.
Correct everything.
Number 9, authorizing agreement with ProAct. Number 10, authorizing renewal agreement with Delta Dental. Number 11, authorizing renewal with Lifetime Benefit Solutions for Section 125 Administration Services. And number 12, revising the Madison County Management Compensation Plan. Mary Kavanaugh, Chairwoman, Government Operations Committee.
Mr. Chairman, I move these resolutions for adoption.
Resolution's been made. Do I have a second? Second by Mr. Walrod. Is there any discussion? Roll call, please.
Schwartz. Wynn. Bernard. During. Bruder. Cunningham. Stokes.
Aye.
Stefanski.
Yes.
Becker.
Aye.
Kavanaugh. Roberts. Maglioka.
Aye.
Dubois. Corbin.
Yes.
Zupan. Bill Zupan. Oh, peace off.
You're muted, Bill.
Yes.
Okay, great. Fosberg.
Aye.
Moses.
Yes.
Jones. Walrod.
Aye.
1,500 ayes.
Carrie,
Okay.
Mike is here.
Mike is
Is he? Where is he?
Yeah. He's the next one.
Oh, it's nice to see you, Mr. Kevin. Okay, we'll do this again. We have Gail Drury from the County Clerk's Office with 5 years of service.
Can't hear you and don't have the mic on, Cliff.
Yes.
Gail started as a dual purpose clerk in the recording clerk's office, half the day, and then half the day over in DMV. And I don't think I need to explain to anybody that there's a world of difference between the quiet library-like nature of the clerk's office and the hustle bustle and getting cussed out over at the DMV. And when we had a real heavy need of more clerks in the DMV, she was willing to switch over to go full-time in the DMV so that we could handle the incredible volume that was coming in during the peak cycle of the driver's license renewals. And she got up to speed very quickly on what she was doing as a clerk at the information desk, welcoming people as they came in, taking thousands of photographs, scanning tens of thousands of documents for them, and then took it a step further and became one of our cashiers and has been a very proficient cashier, helping customers close out those transactions and helping the Madison County DMV give the county over $1.5 million this year. She was a big part of it. So you'll be very missed. But I'm very excited for you to be able to enjoy coffee with your husband, not have to glare at him as you come to join us across the street. Thank you, Gail. Anything you'd like to say? Thank you.
I'm not in the pictures. Okay.
Okay, next we have resolutions for Finance, Ways and Means. Resolution 13, authorizing agreement with fiscal advisors and marketing. Resolution 14, real property department approved fee schedule. Number 15, authorizing the refund of 21 county and town taxes. And 16, 17, 18, and 19 are all modifying the 2021 budget for central postage, central printing and supply, central telephone, and central garage. And number 20, directing the county attorney's office to draft legislation to allow Madison County to impose an additional real estate transfer tax in Madison County. Matt Roberts, Chairman, Finance, Ways and Means.
Mr. Chairman, I move these resolutions for adoption.
Resolution's been made. Do I have a second? Second by Mr. Moses. Is there any discussion? Roll call, please.
Wynn. Kennard. During.
Aye.
Reuter. Cunningham. Stokes.
Aye.
Stepanski.
Yes.
Becker.
Aye.
Kavanaugh. Roberts.
Aye.
Maglioka.
Aye.
Dubois. Corbin.
Yes.
Zupan.
Yes.
Fosberg. Moses.
Yes.
Jones.
Aye.
Walrod.
Aye.
Schwartz.
Yes.
1,500 ayes.
Carried.
Next, we have Health and Human Services Committee. Resolution 21, authorizing modification of the 22 budget liability and fleet insurance. 22, authorizing the modification of the 21 budget, the preschool special ed program. 23, authorizing an agreement with Dr. Scott Petosa for open services. And 24, authorizing an agreement with Dr. Petosa also for detention prevention services. Alex Stepanski, Chairman, Health and Human Services Committee.
Mr. Chairman, I move the adoption of these resolutions.
Resolutions are made. Do I have a second? Second by Ms. Du Bois. Is there any discussion? Roll call, please.
Kennard. During.
Aye.
Reuter. Cunningham. Stokes.
Aye.
Stokes. Okay. Stepanski.
Yes.
Becker.
Aye.
Kavanaugh. Roberts.
Aye.
Maglioka.
Aye.
Dubois. Corbin.
Yes.
Zupan.
Yes.
Vosberg. Moses.
Yes.
Jones.
Aye.
Walrod.
Aye.
Schwartz.
Yes.
And Wynn. 1,500 ayes.
Carried.
Next, we have our Planning Committee. Resolution 25, authorizing the recertification of Ag District 4C in the towns of Georgetown, Lebanon, Hamilton, and Brookfield. Number 26, authorizing a license agreement with Madison Oneida Boces. 27, authorizing agreement with New York State Housing Trust Fund Corporation for a housing rehabilitation grant. 28, authorizing agreement with the New York State Housing Trust Fund Corporation for the Main Street Program Grant. 29, adopting the inclusion of certain parcels of agricultural lands in certified ag districts. Number 30, appointing a member to the Madison County Soil and Water Conservation District Board. And 31, authorizing a contract amendment with Beardsley Architects and Engineers for a Delphi Falls County Park feasibility and design project. Cliff Moses, Chairman, Planning Committee.
Mr. Chairman, I move these resolutions for adoption.
Resolutions are made. Do I have a second? Second by Mr. Bernard. Is there any discussion? Roll call, please.
During,
Aye.
Reuter, Cunningham, Stokes,
Aye.
Stefanski,
yes,
Becker,
Aye.
Kavanaugh,
Aye.
Roberts,
Aye.
Maglioka,
Aye.
Dubois, Corbin,
Yes.
Zupan,
Yes.
Fosberg,
Aye.
Moses.
Yes.
Jones.
Aye.
Walrod,
Aye.
Schwartz.
Yes.
Wynn.
Yes.
Kennard.
Aye.
1,500 ayes.
Carried.
Next, we have our Criminal Justice Committee. Resolution 32, authorizing agreement with Spectrum Enterprise. 33, authorizing an agreement with DeRidder Central School District for special patrol officers. 34, authorizing agreement with Traffic Safety Research. 35, authorizing agreement with American Mobile Dental. 36, authorizing the chairman to apply for a small rural tribal body worn camera program grant. 37, reappointing a supervisor to the jury board. 38, authorizing the application and acceptance of grant funds from the New York State Division of Homeland Security.
Not the best information, but
Well, we
certainly
got
need to
somebody
look into
background,
it.
somebody needs to mute. Okay. Please.
For public safety answering point operations. 39, authorizing the application and acceptance of grant funds from the New York State Division of Homeland Security for statewide interoperable communications. And number 40, authorizing a memorandum of understanding for emergency first responders training for the year 2022. Pete Walrod, Chairman, Criminal Justice Public Safety.
Mr. Chairman, I move these resolutions for adoption.
Resolutions are made. Do I have a second? Second by Mr. Vosberg. Is there any is there any discussion? Roll call, please.
Reuter.
Aye.
Cunningham.
Aye.
Stokes.
Aye.
Stefanski.
yes,
Becker.
Aye.
Kavanaugh. Roberts.
Aye.
Maglioka.
Aye.
Dubois. Corbin.
Yes.
Zupan.
Yes.
Fosberg.
Aye.
Moses.
Yes.
Jones.
Aye.
Walrod.
Aye.
Schwartz.
Yes.
Wynn. Kennard. During.
Aye.
1,500 ayes.
Carried.
Next, we have our Solid Waste Recycling Committee. 41, authorizing agreement with Clifton Recycling and Yard Waste Grinding Services. 42, authorizing agreement with Scale Service and Supply for truck scale services at the landfill. And number 43, authorizing a modification of the 22 budget for the Environmental Control Landfill. Jim Cunningham, Chairman, Solid Waste Recycling Committee.
Honorable Chairman, I move these resolutions for adoption.
Oh, thank you for that. Do I have a second to that? Second by Ms. Schwartz. Is there any discussion? Roll call, please.
Cunningham.
Aye.
Stokes.
Aye.
Stefanski.
yes,
Becker.
Aye.
Kavanaugh. Roberts. Maglioka.
Aye.
Dubois. Corbin.
Yes.
Zupan.
Yes.
Fosberg.
Aye.
Moses.
Yes.
Jones.
Aye.
Walrod.
Aye.
Schwartz.
Yes.
Wynn. Kennard. During.
Aye.
Reuter.
Yes.
1,500 ayes.
Carried.
And now we go to resolutions under the regular agenda. Resolution number 44, approving trade-in of 2021 Bobcat skid steer loader. Dave Jones, Chairman, Administration Oversight.
Mr. Chairman, do we have to say honorable now?
You don't have to, Dave. I'll give you a pass.
Just
But if
Jim?
you'd like to get some points, that would be nice.
Okay, well, honorable Mr. Chairman.
Please don't
Move
do
this
that anymore.
resolution for adoption.
Okay, resolution's been made, seconded by Mr. Roberts. Is there any discussion? All in favor signify by voting aye.
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 Any opposed? Carried.
Resolution number 45, approving the trade-in of a cat loader in accordance with Madison County's Highway Department 5-year plan. Dave Jones, Chairman, Administration Oversight Committee.
Honorable Mr. Chairman, I'd like to move this resolution for adoption.
Resolution's been made. Do I have a second? Second by Mr. Moses. Is there any discussion? All in favor signify by voting aye.
Aye.
Anybody opposed? Carried. Please don't call me honorable when doing this anymore. Okay, the joke's over because somebody will be out there at a coffee shop saying that I made you do that. So please, there's enough things that I make everybody do that is out there. So
You've been called worse.
I know. I don't need to add to it.
Resolution number 46, authorize the chairman to enter into an agreement with Barton and the Judas. Bill Zupan, Chairman, Highway Buildings and Grounds.
The esteemed chairman, I move this resolution.
Okay. Resolution's been made, seconded by Mr. Bernard. Is there any discussion? All in favor signify by voting aye.
Aye.
Anybody opposed? Carried.
Resolution number 47, authorize the chairman to enter into an agreement with RMS Gravel. Bill Zupan, Chairman, Highway Buildings and Grounds.
Mr. Chairman, I move this resolution for adoption.
Resolution's been made. Do I have a second? Second by Mr. Reuter. Is there any discussion? All in favor signify by voting aye.
Aye.
Anybody opposed? Carried.
Resolution number 48, authorizing the modification of the 22 adopted county budget. Cliff Moses, Chairman, Planning, co-signed by Matt Roberts, Chairman, Finance.
Mr. Chairman, I move this resolution for adoption.
Resolution's been made. Second. Second by Mr. Boyce. Is there any discussion? Roll call, please.
Roberts. Maglioka.
Aye.
Dubois. Corbin. Zupan.
Yes.
Osberg.
Aye.
Moses.
Yes.
Jones.
Aye.
Walrod.
Aye.
Schwartz.
Yes.
Wynn. Kennard. During.
Aye.
Reuter.
Aye.
Cunningham.
Aye.
Stokes.
Aye.
Stefanski.
Yes.
Becker.
Aye.
Kavanaugh. 1,500 ayes.
Carried.
Resolution number 49, authorizing the modification of the 22 adopted county budget. Bill Zupan, Chairman, Highway, co-signed by Matt Roberts, Chairman, Finance.
Mr. Chairman, I move this resolution for adoption.
Resolution's been made. Do I have a second? Second by Mr. Bernard. Is there any discussion? Roll call, please.
Maglioka.
Aye.
Dubois. Corbin. Zupan.
Yes.
Vosberg.
Aye.
Moses.
Yes.
Jones.
Aye.
Walrod.
Aye.
Schwartz.
Yes.
Wynn. Kennard. During.
Aye.
Reuter.
Aye.
Cunningham.
Aye.
Stokes.
Aye.
Stefanski.
Yes.
Becker.
Aye.
Kavanaugh. Roberts. 1,500 ayes.
Carried.
Resolution 50 is pulled at this time. We'll work on that next month. Resolution number 51, authorizing the modification of the 22 adopted county budget. Bill Zupan, Chairman, Highway Buildings and Grounds, co-signed by Matt Roberts, Chairman, Finance.
Mr. Chairman, I move this resolution for adoption.
Resolution's been made, seconded by Mr. Walrod. Is there any discussion?
Yes, Mr. Chairman, I just want to make it clear, I'm not against the Delphi Falls. Contrary to popular belief, I have been there several times. But people are going to go there to see the trails and not the facility. That's all I wanted to make it clear. Thank you.
And I don't think anybody's downplaying that it is not a lot of money. It is a lot of money. Okay, any other questions? Roll call, please.
Corbin.
Yes.
Zupan.
Yes.
Vosberg.
Aye.
Moses.
Yes.
Jones.
Aye.
Walrod.
Aye.
Schwartz.
Yes.
Wynn. Kennard. During.
Aye.
Reuter.
Aye.
Cunningham.
Aye.
Stokes.
Aye.
Stefanski.
Yes.
Becker.
Aye.
Kavanaugh, Roberts, Maglioka,
Aye.
Dubois, 1,500 ayes.
Carried.
Resolution number 52, authorizing the chairman to amend a pilot agreement with Helios Energy. Mary Kavanaugh, Chairwoman, Government Operations Committee.
Mr. Chairman, I move this resolution for adoption.
Resolution's been made. Do I have a second? Second by Mr. Bernard. Is there any discussion? All in favor signify by voting aye.
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 Any opposed? Carried.
Resolution number 53, authorizing an increase for the agreement with Burns Brothers Contractors for testing and repair services. Jim Cunningham, Chairman, Solid Waste Recycling Committee.
Mr. Chairman, I move this resolution.
Resolution's been made. Do I have a second? Second by Ms. Schwartz. Is there any discussion? All in favor signify by voting aye.
Aye.
Anybody opposed? Carried. Okay, we need an approval of vouchers for payment of public or payments. We already did that. You're done. Public comment. Do we have anything back there, Dan, for public comment? Nope. Okay. Do we have any other business before the board? Anybody have any announcements they want to make or anything? Mr. Walrod.
I just happened to notice that there's a quart of maple syrup on Matt's desk, and I have no idea where it came from. I wasn't sure if the camera got an angle on that label.
Nobody can have it.
We, Mark and I met with Extension and Planning and the group that did our Buy Madison before, and we've got some good ideas. And when we get it all congealed together, we'll present it to the board. But I think we've got some good ideas, and we'll roll out a good product when we get ready. Anybody else have anything? Okay, motion to adjourn. Motion by Mr. Moses, second by Mr. Walrod. We're adjourned.